Welcome back to another explainer. So today we're taking what might look like a totally overwhelming, dense medical textbook chapter on traumatic spinal cord injuries, and, well, we're going to flip it into a fascinating, easy-to-follow journey. Whether you're cramming for a big exam or you're just naturally curious about the incredible mechanics of the human body, you are absolutely in the right place.
Have you ever actually stopped to wonder how your brain talks to your toes? Think about it. Imagine your body is this bustling, high-tech city, right? In this city, your brain is the boss. It's sitting way up at headquarters, and it uses this massive, thick bundle of fiber optic cables to instantly zip messages down to your arms, your legs, your organs. But what happens when those cables get damaged? Well, that is exactly what a spinal cord injury is.
Okay, let's run through the game plan for today. We'll start with the spinal cord basics, move into causes and injury types, look at symptoms and diagnosis, cover complications to watch for, explore acute care and rehab, and finish up with a quick revision summary. Simple enough, right?
All right, jumping right into Section 1, the spinal cord basics, or as we like to call it, the information superhighway. So really picture the spinal cord as a two-way superhighway. It exits right at the base of your skull and travels securely inside your backbones, all the way down into your lower back. Now, the downward flowing traffic, those are your motor signals, literal commands from the boss up top telling your muscles to move. On the flip side, the upward flowing traffic carries sensory signals. We're talking pain, temperature, touch, zipping right back up to the brain so you can actually feel the world around you.
Now check out how the nerves branch off this highway just like highway exits. And you actually have 31 pairs of these exits. They start up in the cervical or neck region, move down through the thoracic in your chest, the lumbar in your lower back, and the sacral down at the base. But here's a really cool fact. The spinal cord itself actually ends around your first lumbar bone. So the nerves at the very bottom just drop straight down before they exit. Early scientists looked at this bundle and thought, hey, that looks just like a horse's tail. And honestly, they weren't wrong. That's why it's medically known as the quadra equina.
Moving on to Section 2, causes and injury types. Think of these as roadblocks and traffic jams.
When we look at the data, it's clear that physical trauma is the most common cause of these roadblocks. Car accidents actually lead the statistics here. They make up over 40% of all injuries. That's huge. Right behind that, we have falls at nearly 28%, and that number is actually creeping up as our population ages. The rest of the chart is mostly made up of violence and sports-related injuries.
So when a crash or a fall damages the spine, doctors have to classify the injury based on where the roadblock actually is. The big takeaway here is that a roadblock higher up, like in the neck region, is going to affect everything below it. So that means all four limbs, the trunk, and even your breathing muscles. We call this tetraplegia. But if the roadblock is lower down, say in the chest or lower back, the arms will usually still work perfectly fine, but the trunk and legs are affected, and that is known as paraplegia.
We also have to classify these injuries by how severe they are. Think of a complete injury as a highway that is completely 100% blocked. Absolutely no motor or sensory signals are getting through to the lowest part of the spine. An incomplete injury, though, that means maybe one lane is still partially open. A few sensory or motor messages are still sneaking past the wreckage, which means the patient keeps some feeling or movement below the injury site.
All right, let's hit Section 3, symptoms and diagnosis. Time to map the roadblock.
To figure out what's going on, doctors use this super detailed chart from the American Spinal Injury Association. It's basically a doctor's treasure map. They test very specific muscles to check their strength, and they touch key points on the skin with light brushes or pinpricks. By figuring out exactly which highway exits are still receiving signals, they can pinpoint the precise neurological level of the injury.
Now, because the spinal cord has very specific lanes dedicated to specific signals, partial injuries end up creating highly predictable patterns or syndromes. Let's say the neck is bent backward way too forcefully. That squeezes the middle of the cord, causing what's called central cord syndrome. And because of how the lanes are stacked, this actually affects a person's arms much more than their legs. Crazy, right? Or take anterior cord syndrome, where only the front of the cord is damaged. The patient loses movement and pain sensation, sure, but they might still feel light touches because those specific sensory lanes are safely tucked in the back of the cord. It's just a massive marvel of anatomical wiring.
Next up is Section 4, complications to watch for, or what happens when the city systems start glitching. You see, a roadblock doesn't just stop traffic, it messes with the whole city grid.
Immediately after an injury, the cord can actually go into spinal shock, which is a temporary, total shutdown of your reflexes. If the injury is high up in the neck, the brain literally can't tell the diaphragm to breathe, so a ventilator has to step in. Down the road, disconnected muscles can get super confused and overly tight. That's called spastic hypertonia. Plus, without normal everyday movement, patients face a really high risk for skin pressure sores and even dangerous blood clots, like deep vein thrombosis down in the legs.
But listen, if you only remember one complication from this entire explainer, make it autonomic dysreflexia. This mostly happens with injuries from the chest up. Imagine something minor happens below the roadblock, like say you're wearing tight pants or you just have a full bladder. The nerves try to send a warning alarm up to the brain, but the signal just slams into the roadblock. The body starts to panic. It kicks off this massive, totally confused reflex that causes a patient's blood pressure to spike dangerously high. It is a genuine, life-threatening emergency, and doctors have to intervene immediately to fix whatever triggered it.
Okay, Section 5, Acute Care and Rehab. Let's talk about repairing the highway.
Recovery is a highly structured process. First, paramedics and ER doctors rush to keep the spine perfectly aligned so there's no further damage. Sometimes they even do surgery right away to relieve pressure. Next is immobilization. You might see patients wearing what's called a halo brace. It's this literal metal ring around the head connected to a vest, and it keeps the neck perfectly still so the bones can heal. And finally, the patient jumps into active rehabilitation. This is where physical therapists step up as the ultimate guides. They teach wheelchair skills, how to substitute different muscles, and totally new ways to conquer everyday tasks.
What's so incredible here is that, yeah, the main superhighway might have a permanent roadblock, but the story does not end there. With intense physical therapy, some really cool adaptive equipment, and cutting-edge therapies like locomotor training and neurotechnologies, patients learn to build these incredible detours. People with spinal cord injuries go on to drive, to work, play sports, and live incredibly active, fulfilling lives.
Finally, Section 6, Quick Revision Summary. Time for your study buddy check-in. Consider this chart your ultimate study cheat sheet. It matches up that heavy medical jargon with our superhighway analogies so it really sticks in your brain. Tetraplegia, that's your high roadblock affecting all 4 limbs. Paraplegia, your lower roadblock affecting just the trunk and legs. A complete injury means all lanes are 100% closed. And autonomic dysreflexia, well, that's that dangerous, confused alarm system you always need to watch out for. To wrap up our explainer today, I want to leave you with a thought. We just saw how incredibly hard the human body and our medical teams work to reroute signals and overcome physical roadblocks. Knowing all that, what can we do in our everyday lives, in our schools, and in our cities to make the real world seamlessly accessible for those navigating life on a different path? Think about it. Thanks so much for learning with me today, and keep asking those great questions.